Today we will talk about pharyngeal arches and its derivatives. We will start with the definition. Pharyngeal arches develop as six mesodermal rod-like structures. They are V-shaped and located between the stomodium and the pericardial bulge. If we talk about its anatomical structures, then externally they have four pairs of ectodermal clefts and internally they have four pairs of endodermal pouches. Notable point is that the fifth pharyngeal arch will disappear during the development. As we can see, this is the longitudinal section of the pharyngeal arch. First pharyngeal arch, also known as the mandibular arch. It develops many skeletal elements, nervous elements, and the muscular elements. So, if we talk about the skeletal elements, then Meckel's cartilage, it has two parts, dorsal parts and ventral parts. Dorsal parts includes malleus, incus, and spine of sphenoid, and ventral side includes spinomandibular ligament and the mandible. Other skeletal elements that develop from the first pharyngeal arch are maxilla, zygomatic, palatine, nasal, lacrimal, frontal, and parts of the temporal bone. Mandibular nerve also develop from the first pharyngeal arch. Masseter muscle, temporalis muscle, middle and the lateral pterygoid muscle, mylohyoid muscle, anterior belly of the digastric muscle, tensor tympani, and the tensor palatine muscle also develop from the first pharyngeal arch. This is the diagram of the Meckel's cartilage. The second and the third pharyngeal arches. If we talk about the second pharyngeal arch, which is also known as the hyoid arch, then stapes, styloid process, stylohyoid ligament, lesser corneae, and the superior part of the body of the hyoid bone develop from this second pharyngeal arch. Facial nerve also develop from this second pharyngeal arch, and all the muscles of the facial expression, posterior belly of the digastric, stylohyoid muscle, and stapedius muscle also develop from the second pharyngeal arch. The third pharyngeal arch. The greater cornea of the hyoid bone and inferior part of the body of the hyoid bone develop from this third pharyngeal arch. The glossopharyngeal nerve develop from this third pharyngeal arch. Stylopharyngeal muscle also develop from this third pharyngeal arch. The fourth and the sixth pharyngeal arches. Skeletal elements which are developing from the fourth and sixth pharyngeal arches are thyroid cartilage, cricoid cartilage, and all other cartilages of the larynx. Superior laryngeal nerve develop from the fourth pharyngeal arch, and recurrent laryngeal nerve develop from the sixth pharyngeal arch. All the muscles of the pharynx and soft palate except stylopharyngeus and tensor palatine muscle develop from the fourth pharyngeal arch, and all the muscles of the larynx except cricothyroid muscle develop from the sixth pharyngeal arch. So this was all about today. We'll meet you again with new topic. Thank you.